legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, March 29th. I'm TMA's Brent Anir. Up this week, improving controlled substance permits, taxing immunizations, and stopping the OIG from imposing penalties during Medicaid fraud investigations. No good doctor tolerates fraud or abuse in the healthcare system, and TMA strongly agrees. But the current Office of Inspector General Medicaid rules label even simple clerical errors as fraud or abuse. TMA believes this is wrong, so a physician leader made that point at this week's Senate Health and Human Services Committee meeting. Dr. John Holcomb told legislators that TMA supports both Senate Bill 1453 by Senator Chuy Hinojosa and Senate Bill 1803 by Senator Joan Huffman. The bills seek due process for physicians who are under investigation by the OIG. Dr. Holcomb told the committee that current rules allow OIG to proceed with payment holds and essentially impound money from doctors without providing appropriate due process. He said it's essential the OIG recognize not all mistakes are tantamount to fraud or abuse. He said current law is vague and confusing, and he added the OIG should not penalize physicians until they've actually been proven to be guilty of something. The state franchise tax adds to the cost of stocking and administering vaccines for some doctors. House Bill 1310 by Representative Angie Button would allow physicians to deduct the cost of buying vaccines from taxable revenues. TMA supports this bill, which is in the House Ways and Means Committee. Another bill that's part of TMA's effort to reduce red tape and improve efficiency for physician practices was discussed in the House Committee on Homeland Security and Public Safety on Thursday. House Bill 1803 by Representative Bill Caligari would increase the Controlled Substances Registration Permit, or CSR, from a 1-year to a 2-year term, so physicians could apply for it when they renew their medical licenses. And, better yet, the bill would allow doctors to use the Texas Medical Board's online license renewal process instead of mailing papers back and forth with the Department of Public Safety. Dr. Richard Benedikt, a San Antonio radiologist, told legislators that streamlining and simplifying the process would be more efficient and prevent potential lapses in patient care.
The system is set up that the renewals are sent out 60 days before renewal. The processing has to be done, sent back to Austin, processed, and returned to you within 60 days. And if there's any lapse, then your credentials at a given hospital or your ability to prescribe or care for patients is delayed and temporarily suspended. During my last renewal cycle, I was up till 48 hours before. There was concern that I would lose my credentials for a temporary period until they were reinstated.
Just 2 more days and he might not have been able to care for patients until his permit was reinstated. His point was that improving this process lessens the chance that the doctor's permit to prescribe controlled medicines would expire. Because if that happens, the patients suffer, the doctor can lose hospital privileges, it can devastate a physician's practice. The companion bill is Senate Bill 1805 by Senator Joan Huffman. Time flies. Another TMA First Tuesdays at the Capitol is right around the corner. The next TMA Legislative Lobby Day is this coming Tuesday, April 2nd. All TMA physicians and TMA Alliance members are urged to attend, and residents and students, organizers especially hope you come to this event. Call TMA or visit textmed.org/firsttuesdays. That's it for now. I'm Brent Anir with TMA. Thanks for watching, and please join us again next week for TMA's Legislative News Hotline. See you then.